that's what's so frustrating about cancer is it feels like it takes and takes and takes away from me. And this was just like one more thing, like add to the list. But at the same time, I have to put myself first, and I do want to move forward with surgery. And so that's what I'm going to do.
I met Clara on social media. Like many of our guests this season, Clara is young. One thing that struck me is how forthcoming she is about how advanced her disease is. And even though she'll tell you that she threw herself a big pity party in the beginning, she does an excellent job of acknowledging the difficulties and working to find joy and meaning. We recorded this several months ago, so make sure to listen through to the end for a little update on Clara's situation. This is Dying to Tell You. Well, Clara, thank you so much for joining us today.
Yeah.
Maybe tell us where you are and a little about yourself, and then we can get into what was happening that made you think something was going on. But first,
Yes.
Who are you?
So my name is Clara Sirks. I'm 31 years old. I live outside of Des Moines, Iowa. And I was living in Colorado Springs for the past 8 years or so full time. And I came back to Iowa when I was diagnosed in January of this year, just to be close to family and friends and like just a closer support system, especially my parents, to be able to be my caregivers.
Yeah. Big changes, right? I mean, diagnosis and moving across the country, all at the same time is just, that's a lot. But and also thank you, because this is, I realize it's been months and it probably feels like it's been a long time since you were diagnosed, but it's still very recent. So thanks for being willing to talk about it.
Yeah, of course. Yeah, I know it. It's been like only 9 months, hasn't even been a year yet, which is crazy.
Right. So in January you were diagnosed, but obviously something was happening before that. So
Sure.
What was happening? What made you think that something might be going on?
Yeah. So last year in 2024, I was having a lot of health issues. I was like a pretty avid runner, and I thought I had injured my hip and my lower back due to running. And so I got an MRI done, and it showed I had a herniated disc at L5-S1, which was a real injury. But as time went on, I tried all the different modalities they recommended: physical therapy, chiropractic care. We did dry needling. I did steroid injections for the pain, and nothing was making like a huge difference. And kind of like at the same time, I had noticed last October, so a year ago, I had noticed a lump in my breast, but because of like all the back pain I was experiencing, I kind of like wrote it off. And then shortly after I noticed that lump, I started getting these episodes of severe lightheadedness and dizziness, where like to the point where I would start to faint when I was standing up. And like it was extremely noticeable when I would go from like sitting to standing or laying to standing. And it was like debilitating. Like I could no longer go grocery shopping. I had to start ordering my groceries because I couldn't walk around the grocery store without wanting to faint. And then I had noticed a lump in the side of my neck, which was my lymph nodes being swollen. And I also kind of wrote that off too, like, oh, I'm just getting a cold or I'm getting sick. But anyway, I was having, like I said, all these problems. And then on top of it, I had noticed I had been feeling really bloated since like Thanksgiving on. And I thought, maybe there's something going on with my GI tract, or maybe, I'm already gluten-free. Maybe I need to go dairy-free. Like, I just didn't know what was wrong. And so I finally scheduled an appointment with my primary care provider, and I had written down like everything that was going on, but I didn't want to go into the appointment as like that annoying patient that lists like 100 things. But I went in there and I'm like, I had him look at a couple things and I'm like, you know what, like while I'm here, like I'm just going to say the rest of it. And I'm glad I did because, you know, providers, they can't piece together the whole puzzle without knowing all the pieces. And so I'm glad I like spoke up. And he had tried to get me in for a scan that day at that office, but they didn't have any openings. And so he was worried about his biggest red flag was like me getting lightheaded and it affecting my day-to-day so much. And so he immediately ordered blood work. So I went downstairs and did blood work that day. And it came back and he called me that night and he was like, you have some concerningly low blood counts, as well as your hemoglobin is really low and you're severely anemic. And he's like, I want to send you in for some further blood testing. And he's like, I'm going to refer you to a cancer and blood center. And he's like, but don't be worried. It doesn't mean it's cancer. It might be a blood disorder or disease. And so in my head, you know, I'm like, okay, like it's probably not cancer. It's probably nothing. But of course, I went to Dr. Google and ChatGPT, typed in all my symptoms, and I was like, asked ChatGPT, like, what is the most likely diagnosis? And it came up with leukemia. So I was like kind of prepared for like there to be a cancer diagnosis. But unfortunately, I couldn't get into the cancer and blood center referral for 2 weeks. But I didn't make it to that 2 weeks because one day I just started throwing up randomly and couldn't keep anything down. And so I eventually just drove myself to the emergency room, which is like right around the corner from my apartment.
Drove yourself to the emergency room.
Yeah. And I was like, the funny thing is because of the lightheadedness, I was like, how am I going to park and then walk all the way in there? And like, I was like holding on to cars as I'm like passing through the parking lot. And
God,
once I
Clara,
got in there, once I got in there, I was like holding on to the desk and they got me into triage. And that's when they finally did a CT scan. And they, like I said, I was in this triage room. They cleared the whole room and the doctor comes in and she's like, is there anyone you want us to call? And I was like, oh, no. Because they were concerned that I was there alone and to hear such like, you know, overwhelming news, you know, alone, I think they wanted to make sure I had support. So I ended up having her call someone at the time and he came and that's when they told me, you have cancer and we're going to admit you, but we don't have a cancer floor. So we're going to transfer you to a bigger hospital here in the city that has a oncology unit and get you set up with a plan and a doctor. I think what was hard was when she said that I had cancer, it felt like this out of body experience. And I felt like, well, surely they're not talking about me. Like they're talking about somebody else. Right. So I called my mom and my parents came out right away to Colorado. But we kind of already had suspected leukemia, like I said. And so my mom was already thinking like, okay, well, my mom had cancer 4 years ago. And so she had this established team here in Des Moines and we really liked them. And so we decided to go back to Iowa to get treated and to request that same team. So I have the same oncologist that my mom had.
Oh, wow. And I didn't realize that.
Oh, yeah.
That's
so
cool.
She had stage 3 colon cancer and she's doing really well now, which is great. But it's nice that she has the experience to help me like navigate the medical system and like she already had the rapport with that team, which is great. And in Iowa, I ended up doing a liver biopsy. And then that one showed that it originated in my lungs. And so with that, and then with all the mets to everywhere else, then they determined I was stage 4 lung cancer.
Right. Was that a surprise to you?
Yeah, because like I've never been a smoker and like I know like a lot of people my age like vape and stuff, and I never did that either. And I also never tested positive for COVID. Like I didn't present with typical lung cancer symptoms. Like I didn't have a cough or, you know, blood in my cough or anything like that. So I was shocked.
Right. I mean, you don't have the typical risk factors of smoking or like working in a place where you're breathing in a lot of smoke or junk,
Right.
or you're a runner. I don't know. It's not something that you would have expected, and even like the symptoms that you were having with your back, your hips, the lump in your breast, the lump in your neck, like none of that makes me think. I mean, and I'm not an oncologist, but I've been around
Mhm.
for a while and
Yeah.
seen a lot of stuff, and like that doesn't make me think lung cancer.
Yeah.
Yeah, it's just strange. So what kind of lung cancer is it?
It's non-small cell adenocarcinoma.
Okay.
We figured out that the cancer was also in my bones. And
Right.
so that's what all that like additional pain around my
Right.
hips
Right.
were, and like I said,
Which is also weird because you did have a disc issue, right? That was
yes.
real.
Yeah.
But in addition to that, you had all this pain because of the metastases in your bones. And like you wouldn't know, right? You see the disc, you attribute all the pain to that, which of course, and then you just move on.
Mm-hmm.
You wouldn't think that you have lung cancer because you have pain in your hips.
Right. And so I guess I forgot to mention, so after I had done all those different treatments for my hip, they did another MRI. And that MRI was right before I saw my primary care provider in January. And that MRI showed I had a weakened bone marrow signal, which kind of, that's why I also thought it was leukemia or something to do with blood and bone marrow. Yeah. So it was very shocking.
Yeah, very shocking. All right. So you're there. It's been like 48 hours, now that you have lung cancer. You go from, I'm always just surprised, or maybe not surprised. It's striking, I guess, when people tell me about their experience, especially when somebody goes into the hospital, into the emergency room, or into the hospital for some reason, and then they find out that they have cancer. It's like 48 hours from being okay to throwing up a bunch, and then going to the ED, and then finding out you have lung cancer.
Yeah.
Just what a shock, I guess.
Yeah. And how like quickly my life changed in just a couple days is crazy.
Right. So you're there in the hospital. Your mom has come. Your brother also, you said?
Yeah. And my dad too. Yeah.
Oh, and your dad. Right.
Yep.
So all your family has come to be with you, which is, I mean, that's cool. I mean, that's remarkable. I haven't seen that kind of response from families very often. That's pretty cool.
Yeah, it was so nice to have them. And I was in the hospital for a few days. So my mom stayed with me in the hospital, and then my brother and my dad stayed at my apartment. And then we ended up all driving back together to Iowa. And it was kind of funny because like the night before we drove back, it was like the four of us in my 1-bedroom apartment, like spending the night, like a big slumber party.
Who slept on the floor?
My dad and my brother had an air mattress, and then my mom and I got the bed. Yeah. So after I knew it was like in all these places, I am back in Iowa, they do another scan and it shows it's in my brain. And so that was like devastating to me. And I remember both my parents, when they told me, both my parents were hugging me and we're all crying because we think like, oh my gosh, like because I thought there's no coming back from this. Like this is going to kill me because it's in my brain. And so they started whole brain radiation right away while I was inpatient. And I did 5 rounds of brain radiation off the bat just to get it done with. And I'm really glad we did that right away.
Oh, yeah, of course.
Yeah.
And it was, I'm assuming, effective?
Yeah. So it showed back in February, early February, that scan showed I had 30 to 35 masses in my brain. And then my most recent brain MRI was in August, and it showed that most of them were clear, and the ones that are there are significantly smaller. And so that was like incredible news. And I also felt like that was the first time that I felt confident in saying like, this is working. And like, now I have more faith and hope to keep going because I have data that shows it's successful. And like, not that I doubted, modern medicine before that point, but it was like the first time I could confidently say like, okay, I can live or I can like do this.
Yeah. It's not like you doubt modern medicine, but everybody doesn't get a good response, right?
Right.
I mean, and I can imagine, you go from not being sick to being very sick in a matter of days. And then you go from being very sick, told that you have metastatic cancer, and then you find out that you have 30 to 35 masses in your brain. That's an astounding number of masses in your brain. That's not, not that your brain is small, but everybody's brain is small. There's not that much space, right? It's contained area, and not much can fit in there other than what you already got in there. So thinking about having 30 to 35 places in your brain, lesions on your brain, I can just imagine being devastated by that and thinking, like you said, I'm dying, right? And then doing that radiation and then seeing that it is being effective, I'm sure, has got to be a huge relief.
Totally. Yeah.
Yeah. Yeah. So you did that, pretty much right away, right? When you got back to Iowa. And then you met Dr. Lukenbill?
Yep. Lukenbill. And then we were just waiting for, so with the biopsy that's how they determined what chemo to use, what drugs to use.
Right.
And so we were just waiting for the results from that so he could come up with a treatment plan for chemo. And so I ended up doing 2 chemo drugs plus immunotherapy at the same time. And I did 6 rounds of that. And chemo, like, literally almost killed me. It was...
Well, right.
Yeah.
I was just about to say, because you're so young and otherwise healthy, young person, you're robust. I can imagine that they would just throw it all at you and hit it as hard as they possibly could. That's what they did?
Yeah, that they said because my cancer was so aggressive that they were going to do a very aggressive treatment. They said, well, the good news is when we do an aggressive form of chemo treatment, it tends to work better than one drug and doing it slowly or doing more rounds. And so I was like, okay. And so, we did 6 rounds, and every round was a little bit different. And it definitely got harder as I kept going, but I was tolerating it like somewhat well. I'll do air quotes, up until round 5. And after round 5, I just was feeling extra lethargic and wanted to take a nap, and laid down to take a nap, and was starting to feel like the chills you get when you have the flu, and just put on sweatshirts and blankets, and I couldn't seem to warm up. And my mom kept coming in to check on me, and one time she checked on me like in the middle of the night, and I was unresponsive and she couldn't wake me up. So she called 911, and a bunch of paramedics came. She said there were like 8 of them and firefighters, and they came and they got me down into the ambulance. And when I was in the ambulance, my heart rate had tanked, and so did my oxygen level. And they took me to the emergency room, and I had gone into sepsis. And so I was in the ICU for the first 3 days, completely blacked it out, don't remember it at all. And then on the third day, I woke up and I knew I was in the hospital. I just didn't know like how I got there or like what was going on. And then by that time, they had moved me to a regular hospital room. And I stayed for another week. So that was like a 10, 11 day stay. And that was really hard. And I had just like regressed so much, so quickly. And it was really scary too, because my mom said that her and my dad were following the ambulance like to the hospital. And she was just saying like, this can't be like how it ends. And like, it's too soon. Like, this is too quick. And they told when I was in the ICU, they were working on me and they asked my parents to come back to like a family room. And that's when my mom got really scared because she's like, oh, shoot.
Oh,
like,
the tiny room. Yeah.
Yeah. She's like, oh, shoot, maybe she didn't make it. And I did, but they were just
obviously.
Like, I did. But they were just giving them like an update. They just had to update them. And my mom told me that the doctor said she's a really, really sick girl. And like, it's going to take a lot for her to get back to where she was.
Yeah.
And it did. Yeah. And so we had to push off my round 6 as well. And then after round 6, the same thing happened. And so
again, with sepsis, you went back to the hospital again?
We caught it early. So I didn't go into complete sepsis, but it was at the beginning stages.
But you had another infection.
Yeah. And I did another like 10 days in the hospital. And I remember thinking like, I can understand now why people don't continue on with chemo, because I don't think my body could have taken another round.
Yeah. Good.
But thankfully that was my last one. For now, at least.
Let's talk about that a little bit. I have a feeling that people don't understand how bad people feel when they are getting chemotherapy, and especially when there's a significant infection or something like that that sends somebody to the hospital. Talk about that. Like you said, I can see why somebody would not want to continue on with chemotherapy. What was that feeling like? Yeah.
So like, I thought I knew what sick was, but I didn't at all. At all. And I think like it's hard to explain because it's like a different type of sick than I've ever felt. It wasn't necessarily, like I've said, like a flu sick or a cold sick or, you feel sick because you got injured somehow. It's like, it just like drains your whole body and takes like everything out of you. And it's like a level of being lethargic that I had never experienced.
Right.
And I think that's a big part of it too, is like just so exhausted and you just feel so beat. And I also like had a hard time with like communicating too. Like it's like I had the words, but they wouldn't come out. And just having slow reaction and response times to things. And I also was like relying on a walker at that time because of the lightheadedness episodes. So here I am now disabled, I'm exhausted, and I feel beyond sick all the time, like every day.
Right.
And so it is hard to explain to somebody who doesn't or has never experienced it.
I haven't experienced it. I've one of the sickest that I've ever been maybe was I had COVID fairly early on, maybe like a year into COVID, and I had it before, like right as the symptoms, the strain where symptoms started getting better or less, less severe. But I had the severe kind, and I lost my sense of smell and taste, and I just remember how bad I felt, just so run down, and I couldn't do anything, and I didn't want to eat anything, and I just wanted to lay in bed, and that is not like me. And I feel like I got kind of a window into that feeling of fatigue that, I mean, you just say, "Oh, I just felt so fatigued," and people are like, "Yeah, so what? Like, take a
Yeah.
nap," right? But
Yeah.
it's like it's that fatigue that just makes you feel like you don't even want to, like you don't even want to be alive. It's like, what's the
Mhm.
point? I can't do anything. Did you? So you said that you were thinking. Um, I can see why somebody might not want to continue on with chemo. I can imagine you thinking, I can't do this anymore. Um,
Mhm.
did you ever think, or was your mortality in your mind when you were in that space? Like, I may not continue with chemo anymore, and I know that that may mean that I might die, and that's okay. Was that in your mind? Did that thought come?
I think I think after round 5 when I had gone into sepsis, I remember thinking like cuz it's so interesting because it's like I had, taken a nap and basically had just fallen asleep and like that was
Right.
that. And I remember thinking, well, if that's what death is like, then like I'm okay
Mm,
with it because it was just really peaceful. I just went to sleep. Um and yeah, it did kind of feel like, okay, well, if this is my time, like that's okay. And it is
yeah.
what it is. But I didn't want to give up, but it's like such a weird thing. It's like I want to keep living, but I also understand if my body can no longer take this.
I have also heard a lot of people say what you said, which is when that time comes, when you find yourself actually close to death, there's not much other than, well, that's okay. I don't want to die, but if I do, then that's all right.
Yeah. And it like sucks to like have to feel that way,
Mm,
especially so young.
yeah.
Um, but I also knew like after round 6, I knew that that was my last round. So I was like, okay, thank God I'm done for now. Like I think after round 6, it was easier because I knew I could keep going knowing chemo's now behind me.
These four white walls have become my new home, but I'm getting bored of always being alone. So what do you say? Do you think I'll make it out today?
So you were doing that chemo. You mentioned that you were dependent on a walker to get around, and
Hmm.
every time I see you, you look bright and like you feel well. Generally, now,
Yeah.
are you feeling back to your normal self, or kind of close to back to your normal self?
Yeah, I would say closer to my like normal self. I definitely have more energy since like the further I move away from chemo. And I it took me a while to get rid of the walker. I kind of like had to transition slowly. Like I was using a cane for a little
Oh,
bit
that's
and then
cool though.
tried doing things on my own.
Cane? Yeah.
Yeah, so I'm feeling much better with not having to use a walker anymore. And I'm also driving on my own again, which is nice to feel like a sense of independence that I didn't have before.
Hmm.
And I'm definitely feeling closer to my old self, but not 100%. And starting to get active again with, I go to yoga and cycling classes, and
Oh, wow. Okay.
I adopted my dog, so we go on long walks.
He doesn't look like he's ready for a walk right now.
No, not right now. That's funny.
I'm curious because in December of last year, you were here living your life, being a young 30-year-old woman. And then, plot twist, you're sick, you move back home to Iowa, and now you're kind of through this. I mean, I'm just kind of picturing it like a dark tunnel, and you're coming out of it now. I'm wondering how you're seeing life now. What are you doing with your life? What do you imagine is going to be the future for you?
Yeah. So with going through treatment, like cancer really is a full-time job. And
right.
with how many appointments and how long they take.
And going to the hospital.
Yeah. And then not to mention being in the hospital. So I haven't been working this whole time, which actually has been a huge relief and huge like weight off my shoulders. Not to mention like the mental health like aspect of it has been nice to not have to like worry and stress about a job. I think a big part of that is like, I always worry about like letting the team down or not contributing as much as I should. And so luckily I don't have to worry about that with not having a job. And so thankfully I was accepted for disability. So that's kind of how I receive income right now. And that's not to say I'll never go back to work, but that's what I'm doing right now until I kind of get over this next hump. And because I have surgery on December 1st for my pelvic tumors.
Yeah, you were waiting on word when we talked before. You were waiting on word to see whether you're going to be able to do that surgery or not. Would you talk a little bit about what that surgery is and why you need it?
Yeah. So I have the biggest two masses are in my pelvis, kind of like growing from my ovaries is how I would describe it. And one of them is like the size of a golf ball. And then the other one was the size of a softball, and it shrunk a little bit from chemo, and it's now the size of a baseball. So it's still huge. They caused me a lot of pain and discomfort. And like that was the bloating feeling I was feeling last year. Is because of those, because they're kind of like protruding and kind of like push out on my stomach. And not to mention they sit on top of a bunch of different organs down there. And so they really affect my quality of life because they cause me a lot of pain.
Yeah.
So I had like, really advocated and like laid down like my case and like presented it to my oncologist and was just like pleading for like, please, can I have surgery on these? And at first he said no because they were in the way of so many other organs. And because at stage 4, I'm at such a high risk for complications during surgery.
Right.
But now that I'm like through radiation and chemo and we saw good results, and I'm now a much better candidate for surgery. So he talked to one of his surgeon friends and he agreed to take my case. And so we got it scheduled for December 1st, and they're hoping to get both of them out, which will be a huge relief.
Yeah. And we don't have to talk about this if you don't want to. One of the videos I saw on your TikTok was talking about the surgery and your ovaries, and it sounded like it was pretty devastating to hear that this was going to affect your ability to have children at some point. Do you want to talk about that a little bit?
Yeah, I'm happy to. Yeah, so with them removing my ovaries, it's not like a full hysterectomy because I'll still have a uterus, but they will remove both of the ovaries. So basically, I could do egg preservation, which is like freezing my eggs and saving them for later down the road. However, it's crazy expensive, and I've seen anywhere from like $15,000 to $30,000 for egg preservation. And I think it kind of comes down to, so there's this organization out there that would cover the cost of freezing your eggs if you were to donate half of them. And so I applied but I was denied because I have cancer. And so like that just kind of hurt a little bit because it's like, oh, like are my eggs tainted because I have cancer? And then I looked into like there's other organizations that'll help cut those costs significantly. But even if I get them the price down a lot, it's still pretty much out of my budget, to be honest. And that's kind of, you know, and again, like that's not something I ever thought to save for because I never thought I would need it.
Of course not.
Yeah.
Right.
And so like, I don't have this like fund set up, like ready to pay for it. And especially with such a tight deadline of December 1st, you know, that's only a few weeks away now. And I just don't, like I said, I don't think it's in my budget. I also don't think it's responsible to take out a loan to cover those costs. For me personally. And then I also don't think it would be fair to, for me, it's like, I don't think it would be fair to, you know, go through a surrogate or whatever and have a biological kid at this point, because I don't know if I'll be around to raise them. And that's just something I need to consider. And I just don't want to, you know, leave them motherless. And
of course not.
And I always say, like, I know that there are miracles and there's people who are anomalies, but I also need to be realistic. I may not be one of those people. And so, you know, what does that look like? You know, leaving a child motherless at 5 or 10 or 15, like, so yeah, it's been a really hard decision to make. And I actually have a consultation at a fertility clinic next week that I'm still going to go, but I think I've already made up my mind to just kind of give up on it.
Yeah. Yeah. I'm sorry. I know that must be really difficult. I just want to acknowledge that, how do I want to say this? Even if you were certain that you wouldn't live past, you know, another 5 years or whatever it is, we haven't really talked about your prognosis, but even if you knew that, just the realization, I guess, that that having children is something that you would not be able to do. I can imagine having that brought to you and put in front of you and said out loud to you must be super difficult for somebody who is young and still, you know, thinking before you knew all of this. I can imagine that you were just thinking, I'm going to have kids someday. And even though you've been through this, you know, this whirlwind of cancer treatment and stuff, that probably wasn't top of your mind when you were going through all this. And so for that to be brought to you and just put in front of you and said out loud, I imagine was just really hard to hear.
Yeah.
You know, I'm sorry that all this has happened. Of course, I'm sorry that is kind of the reality at this point. It sounds really hard.
Yeah, it definitely was hard to hear because I never really knew if I wanted kids or not, but I always wanted it to be like an option. And so it was hard to hear that it's probably no longer in the cards for me to have biological children. And I understand that there's other ways to have a family, which I can always think about down the road. But yeah, it was shocking. That's what's so frustrating about cancer is it feels like it takes and takes and takes away from me. And this was just like one more thing, like add to the list. But at the same time, I have to put myself first, and I do want to move forward with surgery. And so that's what I'm going to do.
Call it thunder, call it rain, never after, it's all the same. Still I love her, it's getting late, it's hard from my eyes go to another place. We'll come right.
what are you hoping for in 2026? 2025 has been a difficult year.
Yeah.
What are you hoping for in 2026?
So I'm actually been really interested in getting involved with advocacy for cancer and specifically lung cancer. So I
Yeah.
have been connecting with some different organizations and um, getting some opportunities to like share my story and next year attend some conferences. And so I'm looking forward to doing that and, meeting folks in person that I've only met like through social media and not face to face. I think that'll be important to me. And I've been involved in my local cancer organization here in Des Moines. It's called Above and Beyond Cancer. And they put on a lot of like free events and classes and things. It's nice that my mom and I can attend those together because she had cancer too.
Oh, right.
And so I really enjoyed doing that with her. And they're actually having a gala in 2 weeks that we're going to, which is exciting. And yeah, connecting with others is so important to me, especially in person, because you can only do so much virtually. So I was a graphic designer before cancer. And although I love art and I still freelance like on the side, but I think my purpose is now within advocacy and kind of helping others who aren't maybe as vulnerable or open to sharing their story as I am. So,
Yeah.
I say cancer takes and takes and takes, which it does, but it also has given me so much and given me these opportunities and these lessons I would have never had prior.
You have a life, right? You have, we don't know. I mean, I don't know how long you're going to live, but you have life left to live, and you could spend your time pouting about it, or you can look forward and figure out how you're going to write the rest of this story. And I really, I like that. I like that you're able to name the things that cancer's taken from you, and at the same time, look forward and say, I'm finding new purpose here.
Yeah, I think it's important to always have something to look forward to kind of keep you going. And yeah, I think and it's hard too though, like I said, with not knowing how long you'll live, it is kind of hard to plan things like out too far. But in the near future, in the next 6 months, just having a couple things to look forward to, that definitely keeps me going.
Yeah. Has anybody talked to you about your prognosis? Like how long they think
Yes.
you're going to live?
As much as I love my oncology team, I felt like they just said basically, you're responding to treatment really well. And we think that you're going to live for years to come because of how young you are and, otherwise prior healthy. And like, although that's great to hear and that gives me a lot of like optimism and encouragement, again, going back to, I want to be realistic. And so I actually saw a palliative care doctor and just kind of confirmed, like, am I reading these survival rates correctly? And the survival rate for stage 4 lung cancer for 5 years past diagnosis is about 9%. And so as much as I do think I'll be part of that 9%, but who's to say I'll be, make it to 10 years or 15 years or beyond.
Right.
And so I was thankful for her for being real with me. And she said, if there's anything you've wanted to do in your life, like do it now or do it in the next 5 years. And then anything beyond that is just a bonus. And so that gave me a new way of like looking at things too.
Yeah. I'm glad you got a palliative doc to talk to. In my experience, they are very good at, they're not good at guessing how long people are going to live because doctors are just bad at that. But I think they're realistic and will be honest with people about that. And yeah, I mean, the 5-year survival rate is 9%. That's pretty low.
Yeah.
Yeah. And you might be part of the 9%. You are young and you are robust and, likely, right? I mean, I think I'm hopeful for you. And the advice of if there are things that you have wanted to do and want to make sure you do them now is good advice. not only for somebody with cancer, because none of
Yeah.
us are promised tomorrow, and because it is guarding against regret, which is something that my palliative team has talked about a lot. If you have something you want to do and you do it now, you're not going to regret it. There's, you know, but if you put it off and you don't get your opportunity to do it, you might regret it. So why not just go ahead and do it, right? And that, again, is for everybody. So yeah, good advice. What are the things that you want to do that came up for you when she said that?
Yeah, good question. I think, well, I really want to go skydiving, and
I wrote that down. Yeah. That's fun.
So the Above and Beyond Cancer Group here in Des Moines, Iowa, they do it every summer. So I'm going to go next summer with them. And then my other one that was on my list was adopt a dog, which I did. And then my third one is just to travel more, and not necessarily like to Europe or far away. Just, I really want to take like a beach vacation to like Florida, and that's very reasonable and doable for me. So yeah, those are just kind of small things too, can be on your bucket list. And because I think sometimes people think it has to be these huge, like a once in a lifetime trip to Paris. And it's like, or we could just go somewhere like New York City and make it a little easier. And that's on my bucket list too, I guess, is New York City. I've always wanted to go there, and I've always had this like obsession with it, and I've never been there. So maybe in the fall time next year would be a good time for that. And just, I think ultimately just spending as much time as I can with my family, especially after living so far away for so many years. I really have appreciated being around to spend time with them, and also being around for my friends, like important milestones in their lives with getting married and having babies and being able to attend those events.
Yeah. That was going to be my next question is, are there things that are not big bucket list items, just normal things that are important to you that you want to make sure you're doing, and that's it, right? Spending time with people, being there for your friends, spending time with your family. What's been the hardest part of this year?
Oh, good question. I would say the hardest part was, besides cancer, the hardest part, I think, besides cancer, like overall, the hardest part was the adjustment of going from Colorado to Iowa and no longer being independent, no longer living alone, and needing like so much help from other people that I, didn't ever think I would need as a 31-year-old adult woman. And that's been hard to accept help. And it's also been hard to identify what I need and communicate that, because people can't read your mind, and so that was a hard lesson to learn. And I think I'm much better about it now. And yeah, I think that was hard. Leaving all my Colorado friends too was really hard.
Yeah, I'm sure. You're making me think of one of a lady that we had on. I think she was our second guest. Her name was Nancy, and she also had cancer, and she was also really struggling with the need to ask people or to have somebody else care for them, to care for her, because she was the person in all of her groups. She was the person taking care of other people. You mentioned not only needing care, but the need to be able to voice what you need from other people and being willing to ask. That's got to be really hard, going from being a young independent woman living out here all by yourself, not by yourself, but on your own, and then going back. You mentioned before, like how it's taken so much away from you, it's taken your independence, and I can imagine how hard it would be to be able to voice the things, not only to need the care, but to have to ask somebody to do
Mhm.
something for you. It's just, yeah, it's got to be really difficult.
Yeah, and just like drawing boundaries too, because I remember early on, people wanted to like visit me a lot, and
Mm.
I had to tell my mom like, you're gonna have to
Hmm.
start saying no to people because like I'm not in the space to visit, and
Yeah.
so yeah, not only voicing your needs, but voicing like what you don't want to.
Yeah. Yeah. Wow. Yeah. That's a really good point. It's got to be really hard. I don't know you all that well, but I can imagine just you seem like the kind of person who wants to accommodate people and
Yeah, I have a hard time saying no.
yeah,
Yeah.
right. Yeah. Yeah. So good for you. I have a last couple things to ask, but before we get into the wrapping up questions, where can people find you on social media if they want to follow you? And is there anything else you want people to find? You know?
Yeah, so you can find me on Instagram and TikTok, the same handle for both at C_CIRKS, which is my last name. And then if you want to see any other interviews or articles that I'm featured in, go to my link in bio on either Instagram or TikTok, and I have a link tree with a bunch of different links there you can check out.
Cool. And I know you had a little bit of well, you had hats for sure. I thought you were going to wear your hat.
Oh, my merch.
Yeah.
Yeah.
Is that still open? Can people still get that? Are you going to keep it open?
It's not open anymore. We did, we opened it twice, and then maybe we'll reopen it after the new year or something, but it's closed for now. Yeah.
Okay. Cool. Well, people can follow you and you'll mention it on your social media. Okay.
Yeah,
cool.
Definitely.
All right. So last couple questions. Thoughts on the afterlife? You have any ideas?
I definitely believe in an afterlife. I guess
Okay.
I just don't know what that looks like or what it entails. I do identify as Christian and I attend church regularly. So, but yeah, I don't think anybody truly knows, but I like to believe there's something there. Yeah.
Yeah. What do you hope? What do you hope it's like?
I definitely hope I can reunite with loved ones that have passed. And I think my hope is that anyone who's passed is no longer in pain or suffering, especially if they were older and really sick. And, my grandparents were married for like 65 years. I hope that they're together in heaven and that I'll be able to see them again.
Cool. All right. And the last thing we ask everybody is, how do you want to be remembered?
Oh, good question. I think I just want to be remembered as somebody who is not afraid to share and not afraid to talk about the hard topics and be vulnerable. And I think ultimately with doing all that, helping others and help others know that they're not alone. I think that's important.
It's good. Well, that's definitely you, and I will remember you that way for sure.
Oh, I appreciate that.
Yeah. Good job. Well, thanks so much for being on the podcast.
Yeah.
Hopefully, I'll check in with you after your surgery in December. I'm hoping that you're just going to be relieved and that 2026 is a better year for you.
Me too. I appreciate that. Yeah. Thank you for having me.
Yeah, for sure. Thanks so much.
Yeah.
Thanks so much to Clara for talking with me. Your mother's advice about attitude and its role in your treatment is paying off. It's a good example for all of us. Since our interview, Clara had her 7th round of chemotherapy, after which she ended up in the hospital again for 10 days. At that point, Clara made the difficult decision to stop chemotherapy treatment as she recognized that it was just too hard on her body. Thankfully, her oncologist did another round of genetic testing, which identified a genetic abnormality that has a targetable therapy. She was able to start that therapy, a daily pill, in December, and she reports that she's having little to no side effects. She'll have scans soon to find out if it's working, and she's still hoping to have surgery to relieve some of her tumor burden. Clara and I plan to keep in touch and record a follow-up episode in a few months. You can follow Clara at C_CIRKS on TikTok or Instagram. Thanks as always to my friend and producer Chris Rock, and thank you all for listening. Remember, life is full of difficulties, but it is also full of opportunities for joy. Let's acknowledge the difficulties and take the opportunities for joy when we find them. This is Dying to Tell You.